Bone marrow aspiration and biopsy are most important investigation in the diagnosis of hematological disorders. Generally, bone marrow is indicated in patients with severe anemia or suspected hematological malignancies. Once it is suspected from the peripheral blood, we decide to do the bone marrow aspiration. The bone marrow aspiration is done using the Jamshedi needle. This is called a Jamshedi needle. Here, this is used for an adult patient. The sizes vary between the age groups. In children, it is a smaller needle, but this is used for adults. And with the same needle, we can do both aspiration and biopsy. And once the aspiration is done, aspirate about 2 to 3 ml of bone marrow, and that is sample is taken for taking smears, and slides are sent for staining and examination for specific disorders. And after doing the aspiration with the same puncture, we can do the biopsy. After doing the biopsy is done without the stillet, and once the specimen of biopsy sample is taken from the patient, we always dislodge it using the stimulator. So this needle is just poked like this, and then a sample from inside the needle is taken into a container, and that is put in a preservative and sent for histopathological examination. And the procedure is complete once the needle is taken off. And today we are planning to do a bone marrow aspiration and biopsy for a patient who's 39-year-old, and he was diagnosed to have anemia, which was unexplained, just detected on routine examination. Once from the peripheral blood, he was suspected to have myelofibrosis. So the aspiration and biopsy was planned, and the aspiration is going to be done today. I'm planning to do bone marrow aspiration and biopsy for this patient who's 39-year-old male, and he is suspected to have myelofibrosis since he was diagnosed with anemia. I'm giving a local anesthesia at the posterior superior iliac spine. That is a site where bone marrow aspiration and biopsy is done for an adult. After giving the local anesthesia, I would wait for a few minutes before doing the procedure. Now, using the Jamshedi needle at the same site, the local anesthesia needle is withdrawn, and then I will proceed with the Jamshedi needle by screwing movement to the bone marrow space. Once inside the marrow, the stillet is withdrawn. Using a 20 ml syringe, 2 to 3 ml of aspirate is aspirated. Now the specimen is put on few slides in drops, and using the spreader, the smears are taken like this, which appears like that after drying. Again, the stillet is reintroduced, since I would like to do the biopsy also at the same site. So with the stillet now, again the same technique is followed. Initially, then the stillet is withdrawn, and using the needle, I am doing the biopsy. Once the procedure is complete, the needle is withdrawn and the specimen is dislodged into a container which has got some preservative. The specimen looks like this.